Thank you, everybody. It's wonderful to be here. And we'll start with an understanding of why this is not a health talk, but why it's a health equity talk. And we can think about the circumstances around two different people. We can think about John, a man in New York who works on Wall Street, who has parks for his children to enjoy, who has a farmer's market that comes to his neighborhood with fresh food. He has insurance, and because of the nature of his job, he can leave when he needs to, if he needs to see the doctor, if his children need to see the doctor. Maria lives in Queens. She works for John, and the nature of her work is such that she can't just easily leave to take her child to the doctor. Her child suffers from asthma because where she lives is where all the public buses park every night and idle every morning. And the pollution in her neighborhood has driven asthma rates through the roof for her children and the children in her neighborhood. Her mother has diabetes, but she also can't take her mother to see care because there's no care nearby. And these are structural challenges that we've created. And you may have heard of this concept of the social determinants of health. It's this idea that your postal code has more to do with your health outcomes than your genetics or even your behaviors, whether you choose to smoke or to exercise, to have another glass of wine. Your zip code, your postal code will determine your health outcomes more. That's pretty frightening. And a lot, though, that we can do about it. The Robert Wood Johnson Foundation supported us to do a set of research that we released this spring that looks at what are these major trends from around the world and where is there innovation we can learn from. The innovations may be at the policy level, work for governments to take on, but also at the community level. People don't sit on their hands when they're facing these kinds of challenges for their families. So I'll share a couple of examples of each. Because importantly, Maria's story is not only Maria's story. These dynamics play out in the wealthiest countries in the world and in the poorest countries of the world. And so there's really universal applicability, we think, to these ideas. Because a different future is possible. And indeed, I think the role of philanthropy is profound here to try to take some of these innovations from where we see them today to where they might also address issues in other places. I'll walk through the 6 trends we uncovered, and importantly, building on what you've already heard this morning, these cross-cutting issues of the role of AI and the role of climate. One of the advisors for this research said that climate change is the greatest driver of health inequity that we will face. So we'll talk about these as we go through each of the trends. So I'll start by talking about calls for more equitable care work. It is consistent that women take on a disproportionate share of unpaid care work. This is caring for our elderly parents, caring for our new babies, caring for disabled children. But during COVID, this really exploded, and people have been reconciling, what are we going to do about this? How do we allow women and girls to go to school, to get a job, to start a business when they are shouldering this disproportionate burden of care? Bogota, the city of Bogota, has had this incredible investment. It's now throughout the city, these care blocks that they invest in. It's kind of like a community center. You could, picture the YMCA you might think of. But in fact, when you go there with your child, you drop off your laundry. This is these are people who don't have laundry in their homes, right? So having someone else do your laundry is an incredible sign of dignity. And you drop your child off and they go have fun, and you can attend a training class for tech skills that you might need if you're looking for a new job. If you're caring for your elderly husband, you might take him to this center and leave him to do yoga while you go get a massage. We visited this facility and this woman was having this forehand massage. The dignity, it's not like government services where there's this sense of shame and I can't believe I need this help. It's actually people from the community supporting each other in a way that has freed up hours and hours of women's time. We think this has applicability in many, many parts of the world. There is, not surprisingly, population dynamics that we hear about, but the trends in longevity, highly related to care work, of course, will expand the number of people living around the world over 65 years of age. 80% of that expansion will happen in countries that are lower middle income countries the least prepared for the infrastructure and the support that are needed for people as they age, and as the aging population represents a larger and larger share of our societies. AI is an interesting, if creepy, application here. We know that for many elderly people, loneliness will actually drive towards worse health outcomes. And AI is being piloted as a friend, as a companion, as a conversationalist. So there's lots of interesting connections here. In Japan, which has been thinking about these population dynamics for a long time, they have policy interventions in terms of incentives for companies to keep older workers employed. They have policies in place around accessibility in public buildings and transportation. They also created in the fallout from the tsunami in 2011, these hubs that are really intended to bring generations together, where not only is there learning that's shared and there's company provided, but you address a lot of the stigma around what it means to age. We don't like to think about it, but we're all going to age. And so the sooner we can get our arms around what that's going to be like, the better off we'll all be. One of the trends we found kind of blows your mind in terms of data. Nearly a third of all data is health data. I think global data, I think cat videos, I think what my kids look at on TikTok, it is health data. From my sleep score on my red eye flight from New York to Abu Dhabi, to the electronic medical records that are out there, to major clinical trial results. This data is sitting out there. And on the one hand, is amazing in terms of perhaps personalized medicine, or at least my ability to make choices about my own life based on what my data tells me. But of course, most people in the world cannot afford a wearable technology, and they may not actually have enough health literacy to know what to do with the data in the first place. They may not feel empowered to advocate for their own health, even if they have access to that data. And to the well-known concerns about AI, as we use this data to make more and more decisions, we run the risk of disparities given the data that's in the system. So Ask Nivi is an interesting app where low literacy communities can ask very non-technical questions about health. And the AI has been trained on data from their community. They have a private way to get health information that might better equip them than if they find themselves meeting with a healthcare provider and knowing the questions to ask. So data can, of course, cut both ways, but this explosion, I think, will be reconciling with for a long time. Housing is another one of these interconnected challenges. Affordable housing, demands for new housing, climate migration that is going to challenge the way we've thought about housing in the past is also compounding. And you can see the impact of climate change, not just because it will drive some of that migration, but because the construction industry is so carbon intensive. So this one is a really thorny one in terms of reconciling these different trade-offs. A great example in Jordan, when we think about the Syrian refugees and the lack of housing there, there's a program that will actually pay you to upgrade a portion of your house if you'll agree to take in a family rent-free for 18 months. And again, you can see the concept of multi-solving in this. It creates jobs for people who want to work in construction. It creates, albeit temporary, but shelter for families that are at their most vulnerable points. And it starts to break down stigma. What on earth has to be true for you to leave your home and pitch up in a new country? And so you start to see, again, multiple issues can be tackled by one kind of intervention. 3 billion people couldn't afford a healthy diet a few years ago. You can think about inflation. This number is undoubtedly only going in one direction. Again, the impact on climate, 8 out of the last 10 harvest seasons, blown up by drought, by floods, by the war in Ukraine, by COVID. The shocks to our food systems fall disproportionately on those who are already most vulnerable. So when we think about the roles of policy and communities here, certainly there are community gardens that have been set up to temper this in some ways. But I like what Finland is doing. They're thinking about this very holistically. So they have a school lunch program. Many countries do. Children from disadvantaged neighborhoods can get access to a reduced cost or a free lunch when they go to school. They don't just feed the kids. They don't feed them kind of crappy food, which is what I observe in a lot of these systems. It's healthy food. And they use that lunchtime as an opportunity for education. They teach children about nutrition while they're in their lunch session. I don't know how my kids would feel about that. I feel like they like kind of running around during lunchtime. But this pays off. This is long-term building of health-seeking behaviors. They also have issues with sustainability of food. They import a lot of their food. So how can they get more food independence? They emphasize fish and poultry in their diet so they can be more independent from the imports and then the climate impact of those imports on their diets nationally. One of my favorite examples is around this demand for healthy public spaces. Remember during COVID, the streets turned into cafes. We had bike lanes. We were outside. We're like, this used to be a street. Now it's for baby strollers. We rethought our public infrastructure in ways that many people don't want to let go of. They want to continue to explore what could be true in our healthy spaces. Are they healthy? How do we make them more healthy? There's a place in the United States called Louisville, Kentucky. It's the fastest growing heat island in the country. They had cut down a lot of their trees, City goes to cement. It can't withstand deep rains. And it's just getting warmer. Cement makes everything warmer, as it turns out, around you. And so they launched a clinical trial where trees are the medicine. What a cool idea, right? They have a control group, one part of the city, a low-income community that does not get trees. And for $15 million, they invest in a couple thousand trees in another low-income neighborhood. And they track the biomarkers for inflammation. Inflammation, of course, is a harbinger of hypertension and heart disease. So if you can drive down that biomarker, you know you are reducing the risk of many of these diseases. So they do this, and the biomarkers decrease by 13 to 20% from trees. We hear about broadly this kind of conceptual relationship between nature and our health, maybe nature and stress. But this kind of study really blows people's minds. And it's the kind of data that you really can't argue with if you're the mayor of a city that's looking at costs that are going to blow up because these non-communicable diseases are coming at us at such a rate. These trends are interesting on their own, I think, but they get even more interesting when you think about the relationship between each of these. When you think about the relationship between healthy public spaces and housing, multi-generational housing, and unpaid care work. So when you start to put these together, you start to find these opportunities for multi-solving where your bang for your buck is pretty undeniable. And my experience working with lots of foundations for the last 25 years is most of them are looking for bang for your buck. And how do we solve more problems with each of those dollars? And especially for people who are the most vulnerable. So I'll leave you with a couple ideas I would love for you to explore. One is around data. Clinical trial where trees are the medicine. Like, let's do that everywhere. Let's make sure nobody cannot understand. And no one is going to miss it, the connection that we have here. How do we support more sentinel systems? We did some work with the Gates Foundation to price out what if we wanted a global network of wastewater surveillance systems so that we could know what diseases are emerging in every part of the world. There's a lot of data when we think about climate and health that is emerging. There's always been parts of climate that were bad for you. Pollution has been bad for you. We've known that for a long time. But climate change today is different than typical environmental health risks. We need to understand the difference there in order to inform decision makers of what we think is going to be most effective. And then I would say experiment. We'll send you the report. There's a lot of examples from all around the world. And those examples have the kernels of something that can be applied in new places. They won't fit perfectly. Everything needs adaptation to a local context. But there is an idea there that can be championed in many of the places where I believe you want to do work. I look forward to hearing more about how you will take these ideas into your practice and carry on the conversation outside. Thank you so much.